Going into the office today and doing one of my favorite procedures on one of my close friends and part of my PR team, and that is Kybella. Kybella is injectable deoxycholic acid, which is a naturally occurring enzyme harvested to be injected in the skin, under the skin in the subcutaneous tissue to melt excess adipose tissue, aka fat. Sorry, I can't do things with one hand. I have to grab my coffee, hold on. Oh, see, this is why I can't film and multitask. Honestly, you guys, it's hard being a mom and a business owner and a doctor and a surgeon and having two businesses. Now I need to get a paper towel. This is real life, but we're gonna keep the cameras rolling, honestly, because there's no time in the day to film this content. And if I don't just do this vlog style on the way, living my life, like a day in the life, then it just will never get done. But anyway, deoxycholic acid is a fat dissolving enzyme that we can use to treat stubborn areas of fat. It could be the double chin, it could be body contouring. I actually just did it on my stomach like 2 weeks ago because we're leaving for Turks and Caicos on a trip, and it just gave me an added little like flattening of my like lower abdomen, so where it's not only flat but almost like concaves in a little bit. I'll show you guys when I post that, my bikini pics on the trip. But anyway, we're using it for submental fullness, and when you combine it with something like Thermage, which is an energy-based device that uses heat in the form of radio frequency, you tighten the skin with Thermage and you use Kybella. And then if somebody has like a little hypoplastic chin or not a very strong chin or jawline, you add a little bit Volux or Voluma, a High-G Prime jawline filler, and it's like a little tweak that can just really make a dramatic difference. You probably saw everybody at the Grammys looking really, really good because they're doing these little non-invasive, non-surgical procedures that really can have an impact on your overall appearance. Kybella is one of my favorite, most underrated treatments that's non-surgical. It's a very customizable, very natural looking, very low risk treatment when done correctly by an expert, of course, can really enhance someone's profile view or their jawline. It helps debulk that fullness that occurs under the chin. I actually did a little Kybella 1 vial treatment when I was 41. I'm 46 now, and I loved it. It just really snatched up my lower chin area. I'm pretty petite, but I still would have this little submental fat pocket here despite having a pretty defined jawline. I really just wanted to get that one little stubborn area, and once I did it, I was so happy that I did. So we're going to be doing that today, and in addition to Kybella, we're going to combine it with some other non-surgical options that are very easy, very tolerable, but make a big impact without surgery and will never preclude you from having surgery later on down the line when you're older. This video is something that I've never done on my channel before. I'm going to bring you in the office with me and show you behind the scenes in the treatment room. You'll get to meet Amara, who's my PR manager, and have her take you through the patient journey experience. You guys had asked for more videos like this. Drop a comment in the comment section if you like videos like this that share the patient experiences and journey, because we have a whole series lined up for you if you do. We're about to go into the office, so I'm just waiting to turn in here. Typically, when I do Kybella, I'll do either 1 to 2 vials at a time. Getting rid of that submental fullness can really help accentuate that projection or like the oblique angle view, just to give a really beautiful profile from like all angles. Take you with me into the elevator, and I'm on time.
Gonna go get some Kybella today. No matter how much weight I lose, I always have a little bit of a double chin. Sometimes there's only so much you can do, you know, with diet and exercise. And this has been something that has bothered me my whole life.
Driving up to Steph's office. Look how cute. She's got her little Instagram handle on the building. When I came in, we did my Thermage treatment first, and I'll show you that in another video. Thermage is an energy-based device used to tighten the skin. So the goal overall is to just get a super nice snatched jawline. Dr. Kappel suggested Thermage in combination with Kybella to get the results that I want. So Kybella is for actually removing the fat, getting rid of the fat, and Thermage is used for helping to lift and tighten the area. So together they have very beautiful synergistic results. Like, I'm really excited to see the results. So this is Stephanie Otterson. She works in Dr. Stephanie Kappel's office, and she is doing my Thermage here. She is amazing and so sweet. Everybody in Stephanie's office has such a good, gentle touch. Everything is so comfortable.
How's this doing? Is this okay? You're getting Kybella too?
Yeah, I'm a little nervous about the Kybella.
Kybella, I've had it on my abdomen, but it just makes you swell. It's a little uncomfortable during like the treatment, but overall it's really, really, really tolerable. It's the fear of the unknown, right? You don't know what to expect. You don't know what it's gonna feel like, so you get a little bit nervous, you get a little bit anxious, but no, you're in good hands.
Stephanie was amazing. The treatment was so comfortable. She was so sweet, and I was a little nervous about getting the Kybella done later, and she made me feel so much better. While Nurse Stephanie finishes my Thermage, we're gonna switch over to Dr. Stephanie so that you guys can learn more about Kybella.
Kybella is one of my favorite treatments to melt stubborn areas of fat, and it's great for little stubborn areas of fat that don't go away no matter how much you diet or exercise. Even if you lean out everywhere else, those are areas that are perfect for Kybella. I really love what Kybella does in the submental area when treating people to help like define the jawline, because it's a perfect adjuvant to things like Thermage or Elocore or tightening devices that help tighten the skin, or Volux or jawline fillers which help define the jawline. It kind of is the missing component a lot of times, but 1 to 2 vials is usually necessary for this area. It's a great treatment for that, especially as a option instead of liposuction, which is a cannulated surgical procedure, can sometimes leave textural irregularities or pockets or unevenness in the fat distribution. So Kybella is often used sometimes to kind of fix those contour irregularities that can happen after liposuction. However, disclaimer, liposuction is indicated if there's large amounts of fat that needs to be removed. Like if someone has a lot of adipose tissue or a double chin that's really significant, that more than just Kybella alone is going to help, then usually I will defer and refer to my plastics colleagues to help debulk the area with liposuction. CoolSculpting is another option. I'm not a big fan of CoolSculpting. Back in the day when it first launched, I used it a lot. I loved it, but there has been some problematic side effects, and even myself, I've encountered some side effects with CoolSculpting or the Cool Mini for the submental fat reduction. So it's not my favorite recommended treatment of choice for decreasing adipose or for treating the submental fat area. Kybella is a great option also because you're inducing your body's own responses to eliminate the fat. The deoxycholic acid lyses, which in science means dissolves the fat cells, or what you call adipocytes in science. And once those fat cells are removed, you can't grow them back. The existing fat cells can get bigger or smaller depending on your diet or exercise, but if you maintain the same exercise and diet over time, studies have shown that Kybella will maintain the results as well. Usually I like to start with 1 or 2 vials, and usually it takes about 6 to 8 weeks to manifest the results, and then typically 1, 2, or maybe 3 treatments may be needed. The procedure may be a little uncomfortable. There's like a crescendo, decrescendo in the pain, meaning it kind of hurts and then it gets better and then it goes away. And then later on, sometimes you'll have some tenderness from where the injection sites were, or sometimes there'll be a little burning, pain, discomfort. You're going to get swollen and edematous and have that bullfrog appearance. That's actually a good thing. That's your body processing the disintegrated fat cells, and your body will excrete them through your urinary tract. So basically, you're going to pee out the melted fat that gets injected by Kybella. I never go overzealous with how much I inject, and I like to do conservative injections like 2 or 3 times, spaced about 6 to 8 weeks apart for best results, and I've had great success with it since Kybella launched. One of the people who first launched Kybella was one of my attendings at UCLA back when I was a resident, so we've been using it since way back then.
I'm ready to do Kybella, and we're gonna do some lip filler. I had to do the Thermage first, so I have a half a face of makeup on. Oh my god, you're so cute.
We did a little bit of lip filler. I'll show you guys that in another video. But for the remainder of this video, my lips are gonna be pretty red, pretty swollen. But even with my lips looking swollen, Stephanie is like a magician with a needle. It didn't hurt at all.
I don't know what hold up. You're way. No, I can't even. Oh, I'm going to make you. Yeah, I'm going to have you hold this. That happens to you again.
Okay, I'm a little nervous.
No, you're good.
Is this angle like you?
I see. You can tell I feel like my favorite thing ever.
I'm just gonna meditate through it. Who saw?
Oh my god, did you just say that's what Mary just said yesterday, and she had explained to me what that was.
Who saw?
Yeah. Starting to sing now. A little spicy, right?
That's all? Oh, is it supposed to be more painful yet?
I mean, some people...
Am I psyching myself out?
I think so, but I think you had it built up in your head.
I think it did.
Some people are like, no, it's nothing, and then some people are like, ow, this hurts, you know? This is usually the part where people are like, ow, that's hurting. People's responses can vary. I've done one go with myself when I was running around the clinic, being like, ah, you have higher pain than me. The areas where that Kybella needle sticks, it's going to be a little sore and tender. Sometimes it's just the overall dissolving of the fat cells that can be a little bit stingy, burny, uncomfortable sensation. Again, that happens mainly when you're in the chair, but when you go home, it can be like almost like a dull kind of aching feeling. And like 5% or less of patients, sometimes you'll have this like radiating pain that goes around at the back of your neck. That's an unfortunate situation when that happens, but you never can predict who that's going to happen to, so we always like to just, you know, tell people just be prepared. It's going to be a little uncomfortable, and if you're pleasantly surprised and it's no pain, then like or not no pain, but if it's not too bad.
I'm sitting here like, when's the pain coming?
I feel like patients who build it up a lot for being very painful, if they watch YouTube videos and they go into it thinking it's going to be this horrific experience, then they're pleasantly surprised. But people who are like, like they don't really research it or they think it's no big deal, and they're like, man, this hurts. It's like 5 out of 10 on the pain scale. But I don't even think it's not working if it doesn't hurt.
Another common question I get asked is, Dr. Capel, can you inject Kybella here? Can you do it here? Can you do it here? The thing with Kybella is there's a lot of people who are injecting Kybella that may be not trained along the path to get to where most dermatologists get to when we're injecting Kybella. And what I'm trying to say is, the more you know, and the more hesitant and careful and cautious you are. Ignorance is bliss, right? Half these people are injecting Kybella all over the place, but if they really knew the side effects that they can cause, it can demyelinate nerves, it can cause paralysis, it can cause nerve damage, and you don't want to go into nerve damage category, or territory. So basically, when I inject Kybella, I stay in my lane. I stay in the safe zones. I don't do off-label injections. A lot of people will ask for fat debulking or buccal fat removal with Kybella, or melting the jowels with Kybella. The thing is that your nerves are myelinated or encapsulated by fat-containing myelin sheath, and Kybella can also dissolve that fat. Kybella is going to dissolve fat where it's injected. It's not going to say, oh, that's a nerve, I'm going to not dissolve that fat, but here's a fat pocket and a double chin, I'm going to dissolve that, and I'm going to stay away from that nerve over there, and I'm going to just, it's just going to go everywhere. So when you're cavalier and injecting just everywhere, I think most people who are injecting Kybella off-label in areas where they're not supposed to be is because they don't know the side effects or ramifications if they demyelinate a nerve or get into an area that's off-label or a danger zone. So no, I will not inject Kybella here. No, you're not going to convince me to inject Kybella in an area that I'm not comfortable injecting as a dermatologic surgeon and a board certified dermatologist. But there may be some med spa extender that's injecting there because they haven't gone through the appropriate training in procedure dermatology fellowship or dermatology residency to even know that they're doing something that's completely dangerous. Oh, you got to be on here now. And AJ too. A lot of people will ask, is Kybella painful? And it really ranges patient to patient basis. I always tell people that it is a little spicy during the treatment, especially if you read other reviews and see other YouTubers commenting on their experience. It could be a little discomforting during the procedure as the fat cells are lysing or dissolving, and there's like a crescendo, decrescendo. It gets painful, that lasts a couple minutes, and then it starts to get better. And that discomfort usually happens in the chair with your provider right there. After you go home, it can still, and I feel like a select group of people, like 10% or less patients, may have some pain that continues on through the course of that evening or when they go home later on at night. But for the most part, the pain happens while you're in the chair getting the treatment, and then it kind of subsides, and then you may have some tenderness in the injection sites where the needle went in, but it shouldn't be that significant. Other things to know about Kybella is you're going to get swelling, and so the swelling is actually an expected response and something that you want to happen, because as the swelling happens after Kybella, that means that your body is responding appropriately. Those fat cells or adipocytes are dissolving, your immune system's coming to clear it up, and actually with all that swelling, there's a lot of interferons and chemokines and interleukins and cellular mediators that are being released that are going to do other things like stimulate collagen synthesis and increase cellular turnover and other things as well. So that's another point about Kybella, is it does melt fat, but there is a little component of collagen stimulation as well, which you won't find with things like CoolSculpting or Liposuction. So it could be an added benefit, and one of the reasons why I do like Kybella as a option for reducing fat, especially for submental fullness. What to expect after a Kybella treatment? Usually you'll have some some pretty significant swelling under the chin. You're going to look like a bullfrog. You're going to look like you have a goiter. You're going to look like Benjamin Franklin, not like the sexiest version of yourself. But usually that lasts like for maybe like a week after the treatment, maybe 2 weeks. And it's almost like this like water balloony, like you move your head and it's like jiggle, it's like jiggle, jiggle. It's like this weird water balloon, waterbed kind of watery swelling that is just annoying and does not look nice. And so for the week after Kybella, you may want to stay home and hide and not have any social events or events to go to. Don't let your friends and family see you. And then the second week after treatment, that kind of gets better. There'll be a little subclinical swelling, but for the most part, you're going to look more how you were at your baseline. And then it takes like 4 weeks, and then 6-8 weeks later, you'll start to notice results. You'll start to notice debulking of that area, less volume in that area, and a more defined chiseled jawline. Now, if you want more, you go back and you get a second or third treatment, but sometimes people are just happy after one. So I always say beauty's in the eye of the beholder. I always say you may need 1 to 3 treatments, but you tell me, like as a patient, I tell this to my patients, you tell me where you want to stop or when you're pleased with your response, because you know, the more you do, the better it is. But sometimes people only need 1 treatment, and sometimes they only need 1 vial for 1 treatment, or sometimes they need 1 treatment with 2 vials to start. So it all just depends on how much fat's there, and everyone's anatomy is a little bit different. Some people have more fullness here, some people it goes out to the sides more, sometimes it's like a lot of fat there. So it just really depends on a patient by patient basis. Oh, and one other question that comes up a lot of time is, especially patients who have been seen by plastic surgeons for liposuction, and then they get that compression garment that can kind of compresses under the chin after Kybella. I do not recommend using that because for twofold. First of all, it can cause necrosis. It can cause ulceration of your skin. You don't want to like compress that substrate going through the skin or through the fat. Like when you inject the Kybella, you want it to just dissolve into the adipose tissue naturally and just kind of as it may. You don't want to like compress it and squish it and move it out of the way, or compress the epidermis close to the areas where there is Kybella or the deoxycholic acid, because honestly, like I can't say for sure that it won't increase your risk of like ulceration or necrosis. Not to scare anybody out there, but I just say just be risk averse. If you're going to do Kybella, don't use a compression garment. And if you've been advised, you know, of course this is YouTube, I'm not giving medical advice. I'm just saying that I would ask your provider, hey, if they give you a compression garment, like what is the need for this, and do you think that this is a good idea, and if so, why? Because as a provider, I don't usually recommend using a compression garment because I can think it can increase your risk of necrosis or complications or ulceration. Another thing that people ask is that should I take like an Advil or ice it after Kybella swelling? And there is a component of, you know, if it's going to make you feel better or provide comfort, you can take an Advil or like a Motrin or a Tylenol, but you sometimes want that response. Like having inflammation means that there is signal transduction cascades that are going on, and your immune system is kind of clearing out the you know, the adipocytes that undergo apoptosis, or there's a lot of cellular mediators that are being released, and a lot of like cascades and pathways that are getting kicked off, that sometimes you don't want to dampen that response. Like you don't want to do a compression garment and Advil and ice, because you kind of like want the natural process of the fat dissolving, you know, process to occur. So I'm usually not a big advocate of like icing it too much or doing compression or using analgesics after the treatment. I say just let it be. The ball is going to be rolling. Just let it, nature take its course and take it from there.
Here's the swelling so far. It's just filled with stuff. If you go in to do Kybella for your jawline, you're gonna have to deal with your double chin even worse for a little while, but don't mind my lips. We injected my lips, so I am nice and swollen everywhere. They're not gonna stay like this. So much double chin. Now the swelling will look goofy. This is funny. Like, I'm excited to see the results when all the swelling goes down after the Kybella does its job. I'm super excited. So it is the morning after Kybella, my Kybella and lips and Thermage. So I'm a little swollen, but I'm like almost weirded out at how little pain I'm in. I don't want to set unrealistic expectations for people because I know Kybella is supposed to be painful, but I don't know if it's because Stephanie is so gentle with her injecting. Like my lips too are swollen, but they don't hurt at all.
We didn't do any numbing, and she's like so gentle. I mean, she's been doing it for a really long time, but she's also so much more focused on patient comfort than getting you in and out of the door. And just for everything she does, it's all about how she can make you more comfortable. And it really was like, even the Kybella, it didn't hurt when it went in. I barely felt the needles when she was doing it. Disclaimer, it may hurt when you do it. It's supposed to hurt. When you go into Steph, she just has you iced. I really love that about her because she doesn't rely on the numbing to basically correct for bad form or like rough injecting. I would rather someone be more delicate with me so that hopefully you can avoid excess bruising and swelling. You're still gonna have it, of course, like you're having a needle put in you, you're puncturing tissues, but it's such a different experience with Stephanie. I was imagining the swelling was gonna be so much worse, but this is the swelling. So it's significant, like, you know, that wasn't there before for sure, but it's really manageable. Through the night, no pain. Woke up in the morning, it was a little more swollen, but like no pain. We did 1 vial of Kybella. We're just gonna see what the results are. We'll do more as needed. You don't wanna do more than you need because it can go into areas that you don't want. The Kybella swelling is kind of setting in, you can see. It looks goofy, but it doesn't hurt at all. Kybella swelling can last a few weeks, so you want to plan for that. You know, if you have anything going on, probably don't do it around that time because you're not going to know how you're going to react. If the swelling gets any more than this, then yeah, I probably wouldn't want to go anywhere, but like it is right now, I'm not worried about going places with it. The little bullfrog chin is getting bigger. It feels really funny. It feels like, Stephanie describes it as a waterbed. And it really is. It's like this like watery, jiggly. That's so funny. Oh my gosh. It's a good look for me. Okay, this is 4 days after Kybella. Still have some swelling. We're gonna keep posting updates. And if you guys like the behind the scenes, getting to see Stephanie at the office injecting, we're gonna keep doing these videos for you guys. We do monthly giveaways of Stephanie's skincare line, which is medical grade skincare. I just started using and it's the most amazing skincare you'll ever use. So you want to be subscribed so that you can have a chance to win in the giveaways. We're about 1.5 weeks after Kybella. Don't mind my disaster behind me. We're moving and painting. I'm always a mess when I'm doing these updates, but the results I can already see. I'm super excited. We're gonna put like the side-by-sides and everything when we do the final video, which will be 4 weeks post-treatment. We may do another vial if I need it, but for now, I'm already noticing a difference and my friends and family are also noticing. It just looks like less full under here. If you like these behind the scenes patient videos, we're gonna keep doing these. We've got a whole lot more on deck for you guys. We did a thread lift, we've done Thermage, we've done some filler. We're gonna do some more stuff on me and we're gonna do some filler in my chin and my jaw. We'll keep you guys posted on the final result in a few weeks.
Be sure to like and subscribe and share this channel or video with anyone who wants non-sponsored content by a board-certified dermatologist. Also remember that my subscribers are eligible to win a giveaway where we give away free MDR skincare products each month, but you have to be a subscriber to my channel. It's the only way to grow organically. So if I found you and you found me, it was meant to be and it was without any pharma or big company sponsorships.